Hello, my name's Dr. Abigail Pamich and I'm a clinical psychologist. I'm going to talk to you today about what is a panic attack. So the formal definition of a panic attack is an experience of physical and emotional intense fear. Now this can mean that you go for a few minutes or it could be for longer, but the body goes into an intense state of fear. Lots of symptoms can happen: difficulty breathing, sweaty palms, tunnel vision, changes in your hearing. The mind goes to extreme feeling of being overwhelmed. It's a very unpleasant experience. So what's actually happening when we have a panic attack? The body's nervous system has two responses. You've got the relaxation response or you've got the stress response, which is a fight, flight and freeze response. Now the fear response produces adrenaline, and it's this adrenaline that creates all these unpleasant symptoms in the body. So a panic attack can be thought of as like a surge of adrenaline, like an adrenaline rush. And this surge of adrenaline can make the body feel like it's about to die, and the mind feel intense fear. They're quite scary. So can they be cured? Yes, very much. Panic attacks can be really helped with psychology because it's understanding about what it is, understanding the misconceptions and learning how to work with your body. So for example, one thing is thinking about is a panic attack. The word attack makes it sound like it's an illness or it's something out of control, but actually an adrenaline surge, which is what it is controlled by our mind, and we can learn very much what factors are triggering it for us and how we can actually overcome that. So what triggers a panic attack? Well, the triggers are very individual, but what's actually happening in the mind is it's the middle of our brain, the limbic system, which is a mammal part of our brain that controls it. And in there we have two parts called the amygdala, and they're like threat detectors. So they scan the environment, externally, internal, with our thinking, and they let our body know if we're in danger. And how does it do that? Well, it sends the hormone adrenaline, cortisol and many others into the body in a flood of stress. So it's a stress response, it's a flood of adrenaline, and that leaves us with all these symptoms. So this is really helpful in many ways because prehistoric times we had to run from a saber-toothed tiger, and the more adrenaline we had in our system, the faster we could be. It sends blood to the right muscles. It helps us think more clearly. It can help us be better in different performance tasks. But too much adrenaline, when we have this exaggerated response, this extreme surge, can be very, very unpleasant. So adrenaline surge can be helpful at times if we've got something really important to do, but it's when it's in response to something which is really everyday and a normal experience, like watching something on the telly or somebody saying a comment, and then we have an adrenaline surge and a panic attack, then it can be really quite unhelpful. Another type of panic attacks are delayed, and that's after a very stressful event. Our adrenaline can be quite high from dealing with that stressful event. Afterwards, we can then have a panic attack as it starts to surge. The good thing about these adrenaline surges or panic attacks is psychology can do an awful lot to be helpful. We can educate you on what's causing it and do something called a formulation where we understand for you exactly what's triggering these panic attacks. Because firstly we need to ask, are they actually a message of present danger? For some clients I find that there is something that they need to be worried about or attend to in their environment, whether it's a spouse, that's a relationship that's turning really unhealthy, or something going on at work, or financial issues. There's something that maybe is actually triggering this sense of adrenaline. They need to listen to it and change what's going on in their environment. Or secondly, is this just an over-exaggeration of the body? And if so, let's look at what's causing that. We look at things like caffeine, we look at things like exercise, certain medications, certain diseases have been known linked to these adrenaline surges, the thyroid, for example. So we need to rule out all these different areas to actually try and understand what is creating this panic attack. So in therapy, we'll build this formulation, we'll look at what's creating it, we'll look at all the different things we can do to help you overcome it. So if you'd like to book an appointment, please email me, inquiry@drabigail.co.uk, or for more information, see my website, drabigail.co.uk. And if you like this video and it's helpful, please give us a thumbs up below. Thank you very much.